Hi, my name is Chanel Smalls, and I will be presenting the neurocognitive disorder on delirium. An overview of the condition. Delirium is an acute change in the mental status. The criteria for delirium is, I have listed just a few, not all, but just a few, the major ones. A disturbance in attention. In other words, reduced ability to direct, focus, sustain, and shift attention and awareness, reduced orientation to the environment. The disturbance develops over a short period of time, usually hours to a few days, and represents a change from baseline in awareness and tends to fluctuate in severity during the course of a day. An additional disturbance in cognition is memory deficit, disorientation, language, visual ability, or perception. And all of these have come from the DSM-5 that we are currently using for the course. Here is a video I have and hope you enjoy for you to watch, just to tell you a little bit more in detail about what delirium is.
Delirium is a neurocognitive disorder which is associated with disturbances in alertness. The patient presents with confusion, and this occurs in a fluctuating manner. So the patient sometimes doesn't appear to be fully alert and awake or know what's going on around them, and it's associated with a variety of different symptoms. Delirium is usually caused by acute metabolic problems or substance intoxication, but there are other causes as well, like systemic infections, hepatic or renal diseases, head trauma, seizures, and metabolic disorders. So there are three different types of delirium. There's the hyperactive, hypoactive, and mixed type of delirium. So with hyperactive, the patient has increased psychomotor activity, so they appear very agitated, and they may be speaking very fast or moving very fast, and they appear to be agitated. In hypoactive delirium, we have slow vocalization, the patient may seem withdrawn and inactive, they may appear sluggish, and there is catatonic speech, which basically means they are repeating the same thing, or they could be repeating the same kind of movement. With the mixed type of delirium, we have a shift between the hyperactive and hypoactive states of delirium, and this can happen throughout the day or during the episode. So overall, the symptoms of delirium include agitation, stupor, which basically means they appear almost unconscious, they may feel fearful, they may be having hallucinations and be drowsy or delusional.
Now I will present my article that I have chosen to discuss about delirium. This article I've chosen is about delirium imposed on dementia. This article describes what delirium superimposed dementia consists of and how it is developed. In the article, the authors define delirium superimposed dementia as occurring when an individual with pre-existing dementia develops delirium. And usually, delirium superimposed dementia is more prevalent and most prevalent in older adults, 65 years old and older. And there are three moderate forms of delirium, which was previously discussed in the video that you just saw. And these are called hyperactive, hypoactive, and mixed form. Further in the article, it explains how the use of different screenings can assist with recognizing delirium superimposed dementia. One test is called the Mini-Cog, another is named the Modified Blessed Dementia Scale, then there's the Mini Mental State Examination. The most common used tool in delirium screening, according to the article, is called Confusion Assessment Method. Now I'm going to explain a little bit more about these different tests. The Mini COG test is an excellent screening tool for dementia and can be used to assess the baseline mental status. And that is the initial assessment of a person when they are first admitted to a hospital, or you come into the doctor's office, or it's mostly for patients, older adults that have been hospitalized. And the modified Blessed Dementia Scale is information that is obtained from the caregivers, most likely the relatives who have brought the individual in because of the change of mental status. And this will help to determine if an individual's level of functioning. Mini mental state examination. This consists of questions that measure orientation, registration, recall, calculation, and visual perception. And finally, confusion assessment method is an instrument used to detect delirium in older adults who are hospitalized. The article concludes that delirium superimposed dementia is a very serious problem for the elderly. The author suggests that initial assessment as well as a continuous assessment should be constant practice in order to identify delirium. Because identifying delirium is very important when it comes to care plans and intervention. I have listed 3 national resources for you to check out at your leisure that will give you even more detail about delirium. And these are my references that I had used to put together the presentation that I have presented to you. I hope you enjoy. Thank you for your time, and